Well, hello everyone. This is the real Doc Harmony again. Here I am live. And I am with my dear, dear friend, Dr. True, who is a functional medicine doctor. And I want you to know how generous and gracious Dr. True is. Every twice a year, I have the Queen's Circle. We start and end. So there's two groups. And every session, True is just so generous, comes in and teaches all us women about hormones and functional medicine and health and how to be. Isn't it kind of hard to be the best version of yourself when you don't feel well? Oh, it doesn't really work, does it? And so really it's been shocking. So I've been in her class 6 times at least now and been able to sit on a couple of consultations. This woman is just packed. She is so intelligent and just so vibrant and so knowing. It is just such an honor to have you, Dr. True. And if you could just introduce yourself and let us know a little bit about your story, what got you into functional medicine, and what your real passion is with functional medicine.
Oh, thank you so much, Dr. Harmony, for such a great introduction. I'm Dr. Truc Nguyen. I was actually trained a family medicine doctor, and then inside of my training, I learned that traditional medicine was not really helping my patients. I learned that I wasn't healing people. And at the time, I didn't know I actually wanted to be a healer. And then, so when I discovered, I was like, I'm not healing people. So something wasn't clicking for me. And then, I'm so grateful that I was able to find functional medicine. But what I did was I integrate what I learned from traditional medicine, because it is amazing what traditional medicine can do. I mean, we have so much, have advanced so much in the world of technology and modern medicine. But I felt like bridging the conventional medicine with functional medicine, root cause. So that was missing in traditional medicine. And so bridging that gap between traditional medicine with functional medicine, I now can be able to really treat chronic diseases, which was really where my passion was. And of course, with my own health journey, I discovered if you want to be well, you can't just treat symptoms. And then after 8 years of doing functional medicine, I got into regenerative medicine, because you can't, it's almost like you do functional medicine, you treat the root cause, but there's this whole movement of, being able to reverse your aging, because what we do know about the human body and what we do know about so many things, that we actually can reverse cellular aging and reverse the process of degeneration and regenerate. So I'm super excited about this whole field. Now there's a lot of, there's always one side to everything that we do, right? And there's nuances that you have to know when you practice this type of medicine. So being able to know traditional medicine, functional medicine, and regenerative medicine, I integrate them all to really give my patient the best outcome. And that's what I'm passionate about in sharing with people on how to use medicine consciously with anything that we do, right? So my practice is called conscious medicine. It's really inside of my own development and my own transformation, personal transformation and transformation as a doctor and as a healer. So thank you for having me. I'm very grateful to have this conversation with you.
Well, that is just so exciting. So there's a lot of terms there, and I kind of want to clarify it for people. So traditional medicine, I think you're saying allopathic medicine, and I think that's kind of confusing to people, because traditional medicine for me as a home birther, a homeschooler, an herbalist, a naturopath is think cave woman even, think, the herbalist, think the Native American medicine women. But really, so what I hear is that you're blending this allopathic medicine. Now, I am all about diagnostics, blood work, the diagnostic tools that they have, and we'll get into, with all my heart attacks, and being able to use that in such a way to give us the clues to find a program that would work for, or not a lifestyle. find those real root causes, right, of what was happening there. And then so we've got the traditional allopathic, and then we've got functional medicine, and then regenerative. Can you give us examples? So obviously the example for allopathic would be blood work and diagnostic to MIRs and ultrasounds and things like that. What would be really good, simple examples so that people could really understand what the distinction is between these three levels?
Right. So let's say diabetes, okay, or high blood pressure. So conventional or traditional medicine or allopathic medicine, what we would do is that there's a blood work range that if you meet that range, you would be diagnosed as a diabetic, right? Or a pre-diabetic. And what happens is once you meet that number, you're now qualified to say, oh, I can use metformin, or to a different drug combination, or if you're someone who's very severe, you would be on insulin. So you have a drug that treats that condition. And then with conventional medicine is that you run the labs, you see, okay, you have the diagnosis, but instead of just treating the symptoms or like the numbers, you got to look at, well, why did you develop diabetes in the first place? And in allopathic medicine, it's really, it's your diet, it's what you eat, right? And obesity, right? So lifestyle, nutrition. But if you look deeper, there's actually more than that. Or genetics. Actually, allopathic is, it's like, oh yeah, your family had it, like you're going to have it. That's actually not true. Well, in functional medicine, what we look at is lifestyle do cause diseases, but it's insulin resistance. But upstream, so that's the root, what people are calling root cause medicine is like, okay, well, you have diabetes because you have insulin resistance. That's not true, because not everyone with diabetes have insulin resistance. And not everyone with insulin resistance develop diabetes.
Interesting.
They do not go, like they are associated, highly associated with each other. But if you go upstream from that, there's leptin. Leptin is a hormone produced by our brain that if you have leptin resistance, you can develop insulin resistance. But again, it doesn't mean that just because you have insulin resistance, you will have leptin resistance. So the relationship is very complex. And so functional medicine really look at, well, what's beyond that? Well, why did you have insulin resistance or even leptin resistance? Well, if you look deeper, it's toxicity that you accumulate over the years that you lived on Earth. And we live in a very toxic environment. Unfortunately, it's just where we are. But instead of living in fear, I've learned that you got to learn how to deal with the toxicity load that we're bombarded with every day from our food, from the makeup products, cleaning products
water,
that we use,
air,
water,
plastics.
Right? So, exactly. So there's so many sources, but there is also the infections, hidden infections that don't show up on normal blood work if you don't know how to look for them. And unfortunately, in my training as a medical doctor, I was not trained to look beyond like the abnormal numbers. If you're within the range of normal, we can't do anything. We literally have to tell people like, well, your thyroid don't look super abnormal yet, where it's like you're out of range. Come back in six months, I'll retest you, and then we can do. That was actually the biggest thing I could not live with, because I already know you're having problem, but I couldn't do anything for you until the labs show that there's something wrong. So that was where I started to have a lot of dissonance with the system. But I didn't know. So I was a new grad, I was like, okay, maybe I don't know what I'm talking about. So I went along, but eventually I learned that yes, there is a cause for why you're feeling bad, but your labs don't look normal. It's because the body is so complex. You can't just use a few numbers and say that there's nothing wrong with you. And I think that created the culture in medicine where we dismiss our patients' complaints. And we say, oh, it's just depression or it's just anxiety. Let me just give you something and try to see if it works. And what I saw was I have to put my patient on more drugs every time I saw them in allopathic medicine. So what functional medicine allows me to do is like, okay, what toxicity have you been exposed to? Do you have hidden infection in your mouth? Do you have mercury filling? Do you eat a lot of sushi? Because you can get parasites, you can get, bacteria overgrowth, yeast overgrowth. And like, what other symptoms do you have that is connected to the symptoms of diabetes? Because they're not separate. And we, in allopathic medicine, we tend to separate things. And that was really like, well, we have the same body, everything works together. How is it that we're just focusing on treating one thing and then I send you to one specialist? Oh, you have heart problem? Let me send you to a cardiologist. So that's kind of like how allopathic and functional medicine work. And in functional medicine, we use a lot of like nutrition because we got to clean up your diet. So it's things that people can do. And I find that that's empowerment. You can empower people to do something about their health versus like, you would depend on me for a medication that you have to come see me every 6 months. And all I do is writing a script. And honestly, that was really where I'm just like, oh my gosh, I spent my whole life studying medicine and I have to write script based on guidelines, not my brain, not my assessment of people. Even when I think that this person will not do well on this medication because of, whatever history, I was still told that I have to write those prescriptions. So I was a kind of like a rebel because I was questioning things. I was like, this doesn't sound right. But
it sounds like what functional medicine does that is so important, especially when people have chronic disease, is digs really deep to uncover the why. And as you were talking, I remember the tests that we did, that the reports that you all do, the functional medicine doctors. I mean, it's like 127 pages. You go to the regular doctor, which I do both. Well, I had to this year, but it's one page, like, just as, whereas the test, and I'm drawing the blank on the companies that y'all work, I can't, but it doesn't matter. And it's 127 pages, and it's just and what is really nice about it is the interlinkedness of it between, like you were talking about, the systems. So what I would like to just transition a little bit, because I know that I have a lot of women followers and listeners. So applying this same, I'm 35, I'm 40, I'm not my normal self. A lot of women are having babies late, so they're going into postpartum and then hitting premenopause. Nobody's acknowledging this. It's just now starting to come out on the airwaves. And, a heart doctor just now released some fascinating information that if a woman is having more than 6 hot flashes a week, try an hour, but that's okay. More than a hot 6, not anymore, but not, having hot 6 hot flashes in a week, that they've proven that this increases their chances of blocked carotid artery. That it's not increases the chance, it's a sign that now you need to work with your functional medicine doctor and looking at the heart as well, looking at what is going on, that your estrogen levels or what, and I'm not that expert here, right? Bioidenticals are just, I depend heavily on my functional medicine doctor. And I would really like to talk about, this unprecedented levels of stress that women are having, hormone disruptions, the burnout, and what are the top signs? Like we just said, more than 6 hot flashes a week. You need to be talking to somebody. You can't lose weight anymore. What are your top signs that women's hormones are out of balance? And applying functional medicine, and maybe even regenerative if they're young enough, right? Listen, anyone 35 to 45, you're young enough. Don't wait till you're 50 or 60. That was me. And, to help begin restoring that hormonal balance.
Yeah. Well, it's not a short answer. But
no, I got that. I told everybody, pay attention, take notes. Yeah. Take notes, everybody, because she's going to give it up here.
So on average, right, women can go into perimenopause from when they're about 40 to 55, give or take. Okay. And then usually they'll go into perimenopause for 3 to even 7 years before they actually go into menopause. The challenge with hormones nowadays is that we deal with so much xenoestrogens or plastics that mimic estrogen. So a lot of women are dealing with estrogen dominance. Now, estrogen dominance is a term that you may hear that may make estrogen bad. Estrogen is not bad. It is our vitality hormone, but it's when it's out of balance, when it's dominating compared to progesterone, you're going to have a lot of issues, mood issues, right? Skin issues, and heavy period, cramping. And then there's the epidemic of birth control use that gave women freedom, but at the same time, depending on what birth control you use, they all have similar effect, which is driving down your progesterone and driving up estrogen, which again cause estrogen dominance.
And let me interject very quickly because I know you've got a lot more to cover, but I think it's important to note the UK did a water study about 20 years ago. I read it, and they actually had to stop the study because they were just shocked at the findings that they were finding all of these hormones that don't break down in water in our water supply. So, someone like me who hasn't done birth control and all that stuff, and now my hormones are out of whack, and I'm like, wait a minute, I have glass, I don't use plastic, my car's plastic, nothing I can do about that. But you get the point because it's in our water. So what Dr. True is getting ready to share with you is so important. We can't do anything about our water, but you can do things to help balance that and offset that. Go ahead. I'm sorry. Right. I just think it's so important.
No, a good point. Well, you can do something about the water. It's actually in the US as well. They don't treat drug metabolites. So what you're referring to is the metabolites or waste products of birth control pills, but also drugs in general.
Yes.
You filter all of that out. Reverse osmosis, not the best, but it's one of the few that actually can remove drug metabolites from your water. But that's another topic for another day for sure. But just inside of hormones, there is the environmental toxins that cause us to have these exogenous fake estrogen, and one of which I just want to bring to people's attention to is atrazine, because atrazine was actually studied by a Stanford or UC Berkeley doctor. I forgot his name, but he basically found that atrazine turned all the male frogs into female frogs. And they lost reproduction. And if you don't know, we lost 75% of the world frog population in the past 20, 30 years.
Oh, wow.
This is important because if you also noticing, our birth rate is declining across the globe, right? So we're now seeing that, and just an observation, we're seeing more young people confused about their sexual identity. I would say that maybe there's something to do with that. We should definitely look into it, but the CDC doesn't want to do these kind of studies because the doctor who found this, he actually was paid by the people that made atrazine, and then they said, do not publish the data, and they bribed him. He was like, no, I have to share this with the world. They threatened his family, his wife, and his daughter, but he couldn't keep it to himself. So you guys can look this up, but this is something that we need to know as women because it affects us, but it also affects our men. It affects our children because they're being affected. So in men, it decreases testosterone. We're seeing a massive amount of young men not having enough testosterone. Older men too. So,
and that would explain why they're not motivated, they're not driven anymore, they're less competitive, which there's nothing wrong with those things. Those things built America and built the world and built our infrastructure. So very good point. I mean, so important to note. And it's not a political issue. This is a health issue conversation only.
Yes, it is. And so with hormones, so you see all these external factors, and now there's stress. Right? Now, stress, look at how stressed out we've been due to COVID. So that was kind of like unprecedented. But women, the reason why we're actually seeing more menopausal or perimenopausal women struggling with health issues and a lot of these signs and symptoms is because the adrenals, which are the glands above the kidneys, they serve as the backup organ to produce estrogen when you go into perimenopause and menopause. However, so they produce a weaker form of estrogen. So ovaries produce estradiol, and then the adrenals produce estriol. Now, well, if you're dealing with a lot of stress, your adrenal's going to be like, I'm busy trying to keep you alive. We're in danger right now. I'm doing my best to just keep you sane, keep you alive. And that's all I can focus on. I am not worried about having sex. I am not worried about reproducing babies right now. So that's why you don't have that support from the adrenals. And therefore you actually have more problems and side effects from menopause when you don't have that backup organ working. And so our society is
because they're so stressed out, is what you're saying. So stressed out. All the juice has been squirted out with our fight or flights, whether it's traffic, whether it's work. It's not a mammoth coming and chasing after us. But it's the same effect. And they're just so you're saying that by the time we reach this stage, with our ovaries dying and we're losing the estradiol, that then the adrenals are like, well, I don't have any juice. I don't know what to tell you. It's terrible. Go ahead.
I lost you there.
Oh, sorry. Nope. A little glitch there in the internet. Oh, yep. Yes, go ahead.
Yes. Hold on 1 second.
I'm going to write down the time so we can fix that.
Okay, I think we're back.
Okay, we're back. Yay. Yeah, so go on. So the adrenals are depleted. There you go.
Yep. And so stress has a lot to do with, how our body respond to the fluctuation of our hormones in perimenopause and menopause. And then there's deficiency of nutrients. Our food is so stripped of nutrients now that most women are deficient in magnesium. Magnesium is involved in over 200 cellular function or processes in the body. Without it, you're not going to be able to do the things that your body needs to do to make you balanced, to make you functional, right? Just to work. And then there's vitamin D deficiency. Most of Americans spend 93% of their time indoor. So just by not having sunlight alone has been the biggest detriment to our health. That's actually more important than nutrition, is not getting enough sunlight.
Oh, wow.
So if you want to just be well, go outside every day for 20 minutes, especially in the morning sun, you're actually going to start feeling much better just from doing that. Yep. But we have to resort to taking vitamin D, as a supplement, but nothing beats nature. What do
you think happens in my case? So I go outside in the sun a lot. I'm always maintaining my color and sunshine. But yet my vitamin D levels are still low. Just as an example,
So there are people who have vitamin D mutations in their genes, and so they can't convert sunlight into the vitamin D that you can use. And that's actually pretty common. There's just gene variation. We can call it variation or mutation, but most of us have some kind of mutations in some of our genes that just doesn't allow us to get the right vitamin D. So when it is like that, you got to make sure you can test for it with functional medicine, or you say, okay, I am not getting enough from my, being outside, so I do need to supplement. And most people don't know that we actually need between 70 to 90 units on labs of vitamin D, but most of us average around 30, which is absurd, but we're told that you only need 400, 600 international units a day, which is barely to prevent severe deficiency, which causes rickets. Is a disease of vitamin D deficiency. We don't see it anymore, But if you want to thrive, so it's really your goal, right? Do you want to thrive or you want to be barely making it? So that's all I'm thinking, like, yeah, if I want to live and have and be able to really achieve all the things that we're chasing in modern life, because modern life is very like an ambitious life, man, right? You want all these things, you want to travel, you want to go here, and you want to have all these things, which it's okay, because that's the time that we live in. There's nothing wrong with wanting those things, but I need to have my health to go for those things that I want. And so I need to optimize my nutrient status, my hormones, and get rid of all these hidden infections that we don't talk about in the US. We dismiss parasitic infection, which when I started treating parasites in my practice, that was when I became a mediocre functional medicine doctor to, I would say, an excellent doctor, because I was actually getting the majority of my patients better.
Yeah.
So that's actually my proudest revelation and change that I made in my practice.
Nice.
Made the biggest difference for my patients.
So and I do want to talk about parasites, but going back to this women's issue,
right?
I have been a strong proponent of testing early.
Yes.
So 35, you're done with making your babies, get your testing at least annually so that you know what your proper levels are, such that, and I really would like you to either deny this or confirm this, is that low levels of estrogen in the long run, and you're talking about that vitality, and you're talking about we're going to live, our generation, yours and ours, we're going to have the most centenarians alive ever in all of history, right? Ever, right? So we're going to have just tons. And, do we want vitality? Do we want to still be able to travel? Do we still want to be able to contribute to society? Or are we just going to sit on our lazy boy chair and watch TV, right? So anyways, so what is it? So I know you're talking about magnesium, which I do have to plug in here real quick. Sorry, I can't help it, because, Heal, we carry that amazing OC topical magnesium that is just
amazing.
Fantastic. I put it on every day on my feet, put my socks on, and keep those magnesium levels just awesome, which is why we knew that wasn't the problem with my heart. But I really want another opinion, starting to test and what to look for, so that in my case, as I waited 6 years after menopause to start bioidenticals, and by that time the heart damage was done. By that time the damage was just done. It was just done. So, and it's taken a lot, as you know, to recover. So what can we share? What can you share with women? I just don't want anyone to ever experience what happened to me. And I was just trying to be natural, right? I was just trying, I'm not going to put chemicals in. I didn't understand bioidenticals. I didn't understand what that blood work was really showing me with a proper doctor, functional medicine like Dr. True, that would explain to me what's going on and happening. I would love for our 35 to 45-year-olds to hear this.
So in testing, what you need to know is that you got to advocate for yourself if you're seeing a conventional medicine doctor, because they don't know what they're doing. I'm sorry. It's just, I know in our training, we did not get enough training on hormones. Even the gynecologists and the OB, they just were not trained in this, right? So when you're testing, you need to test for, well, first of all, I need to talk about the timing of testing.
Okay.
So blood testing is good to have. The best version to test is to do a urine test, where you test for hormone electrolytes, and then you test it 5 times throughout the day, because you don't just produce hormones like okay, I'm gonna just have hormones all produced at once.
Right.
Our hormones is actually based on our circadian rhythm, and it changes every single day for women. Men, they produce testosterone every day. No problem with them. With us, we have 3-4 different hormones that changes at any point of our cycle, and our cycle is a 28-day cycle. So if you do a blood test, you need to test on day 3 to day 5 of your cycle, which is when day 1 is when you start bleeding. Day 3 is the best time, because this is when all of your hormones should be pretty low and they're starting to rise. And so you have a baseline of knowing, well, this is when everything should be low, but estrogen and progesterone should be pretty even. They should not be more or than the one should not be more than the other. If you do a urine test, the best time is day 18 to day 21 of your cycle, which is your luteal phase. In that phase, progesterone is always higher than estrogen. So it's a really easy time to test to know like, oh yeah, if you don't have higher progesterone, you have estrogen dominance, probably. Okay, so then you're able to test what your hormones look like. In general, you want to test for a couple of things. In blood tests, it's DHEAS because that's the precursor to testosterone, progesterone, and your cortisol. You want to test for total testosterone, free testosterone, estradiol, estriol, and estrone, progesterone. You also want to test for sex hormone binding globulin because that's the carrier protein. If that is high, usually due to some inflammation or your liver's not working properly, you're going to produce a lot of sex hormone binding globulin, and it's going to bind to all your hormones, making your free hormone low. So that's why you need to know total and free number, because you got to know how to look at the ratio.
And then I want to just point out, I can't tell you how many women say, oh, I got my estrogen levels fine. They're checked. I'm like, you got one test? Like, I mean, it's so, to me, I just find it extreme negligence. But that, I'm not going to rant, but go ahead. Everybody, you need to be taking notes and listening. You have to take these notes and listen to what she says. And if your doctor is not willing, I can say this, maybe Dr. Truc cannot, but I can. If your doctor is not willing to test you properly, don't waste your money and find another doctor.
That's true.
Go ahead. That's true.
Yeah. And I also want to just put out there that not all functional medicine practitioners are the same, because I just want to say that our field is great. The thing is, there's a lot of nutritionists that are functional medicine practitioner, and they can order some tests, but they may not be able to interpret and do the things that you need to do. So if you're going through perimenopause and menopause, it is best to find someone who is a medical doctor, who is a functional medicine doctor as well. I just want to put that out there, mainly because, you know, if you don't know, I want to make sure that I'm not putting out information that may be misleading in any way. So find the right doctor.
I would like to emphasize that even the AMA just recently this year, first of all, they're taking off the black box label, which you can explain to us a lot better than I can, which just means that they're finally saying it's not going to, anyways, whatever. But they are actually saying that low levels of HRT, of bioidenticals, 10 years. So that means I should have started at 40, because at 50, I had my last period. 10 years prior helps eliminate breast cancer, heart attacks, strokes, dementia, Alzheimer's, you know, all this stuff that we're scared of.
Bone loss.
And now they just now are finally, you know, admitting, oh, well, we were wrong again. So, and I hate to even say that they're right now, but you know what I mean? It's like this catch-22, but they're finally catching up to reality. So, yes, but so they're taking us off the black box. Women should get tested earlier versus later. They should get all those tests. And what else should they be doing?
Well, I want to distinguish something here too. So in family medicine, doctors who check your hormones, there's a guideline that they have to go by. So in general, if we use estrogen for prevention of those conditions, there is classification of primary prevention and secondary prevention. Currently, the recommendation is that you can only use estrogen for prevention of hot flashes. Only if you have symptoms, then you can use estrogen. So that's the training. And that's going to be what's kind of like what conventional medicine is behind in, is they're just not trained. And because they're so busy, they don't have the time to learn how really estrogen work. And so they're operating from these guidelines that are not really matching what the patients need. And that's the thing, guidelines are guidelines, but if you don't practice by them, they get in trouble. And so that's really where I see the health system is failing women, is that it doesn't allow for doctors to treat the person appropriately. And so what you may get like pushback from your doctors is not their fault, is really because they're operating inside of like what they deem is the right thing to do. But inside of that, right, you got to know that these are all secondary prevention. That's why they're not labeled to say, oh, you can prevent heart disease, but they should be primary prevention, but we're not there yet. So everything you say is right, that starting estrogen and balancing it with progesterone can be very helpful in reducing dementia, heart disease, and bone loss. I want to speak with bone loss a little bit here. Yes. Is that it doesn't seem like it's a big problem, but more women are getting injured from falls and fractures. So they're actually costing women their vitality. And the moment you fracture up, especially the hip bone, you lose mobility, and the impact is that the woman actually decline after she has one fracture. And so just the immobility, not being able to move, exercise, and just like go and do things, they actually decline very quickly. And bone loss is actually a lot more costly to women and society than what we think it is, right? We focus a lot on heart disease because it's deadly. But if you look at the lives of women who had fractures, they actually lose their livelihood. Like some lose jobs, some can't really have fun with their lives anymore. And then you start to decline and you live a very limited life. So I think that's torturous, if anything, right? So that's why bone loss prevention is also very important to me, that I stress women about, like, you got to take care of your bones before.
And I know you would really emphasize, it's so neat to see older women now with muscles. And I don't mean like the bulky, like get on the bikini stage, right? Like I have a muscle. I'm so excited. I don't have that flabby arm anymore, right? And, but that's strength training and HIIT training. Yes. And how important that it is, especially to have those strong muscles to support your bones. And so it's all encompassing, isn't it, Dr. True? It's all of it is mind, body, spirit. We could take all the right supplements, we could do all the right hormones, but if we're just sitting like a couch potato,
yep,
so. Yeah.
But I do want to go into a little bit of regenerative medicine.
Yes,
and regenerative medicine can actually augment all of the things we do in the world of hormones and women's health. Yes. Is that sometimes hormones can't reverse the damage that's been done to our body. Right. Like in your case, right? Like it's right. Like you started so late. But the regenerative side, there is, so let's say for heart disease, there's I would say a program or a protocol done by the system called EBU, extracorporeal blood oxygenation and ozonation. Is literally where you can remove blood from your body, one arm, and you run it through a system. It filters out all the toxins. It has photomodulation, which is light therapy that targets very specific conditions that you're dealing with. And then you put high dose of ozone, oxygen into the blood, and then you run it back into your system. And the benefits is that you're literally detoxing your blood, and then you're removing things that traditional or conventional detox protocols, even in functional medicine that I use, just can't do. So that is something that I use for people to prevent cardiovascular disease, or people who have had post-COVID syndrome that's just not recovering, of chronic inflammation, chronic autoimmune disease, and chronic fatigue syndrome, right? So that's one system you could use. And then there is peptides. And I know you know peptides. Yeah. The peptides can help you rebuild tissue. It can also, depending on what you're using, it can do a lot of different things for us. But what's even more exciting now that I just got into is platelet-rich plasma for erectile dysfunction.
Yes.
And for women who has severe atrophy of the vagina, where they can't have intercourse anymore without pain, or it's just too dry and just even if you use estrogen, it just it's not the same anymore.
And that is terribly painful.
Right. And so you can actually do PRP injection in that area. It seems painful, and trust me, I was like, there's no way I would, but women.
I know, that was my first thought. I'm like, all right, True, I love you. I think you're great.
I know, right?
But
Well, I'm just letting you know that it's out there. I did not know that you can actually reverse vaginal atrophy.
Wow.
Have massive orgasm again.
Oh, wow.
So, and it treats urinary incontinence. That's what really I was into it for. Is that because it's PRP, platelet-rich plasma, is where you remove your blood and then you spin it down and you get only the plasma rich with platelets and all of the inflammatory signals that you have in your blood, and it has to be inflammatory. If you're on inflammatory medication or supplements, it actually decreases the effect of it or the effectiveness. So when you do this, you inject it into what would honestly, it works for joints. So if you have joint pain or osteoarthritis,
okay, yes, I know, yes,
you also use it, or injuries, any injuries from, I have a lot of patients that play golf, tennis, and pickleball. And so you can use this to regenerate your tissue so you don't have downtime, you can avoid surgery. But the last thing is,
Kevin did this real quick 10 years ago for his torn rotor cuff. Totally fixed.
So you don't have to get surgery, right? Exactly.
Right.
Yeah, it's really amazing. And then for men, the PRP actually can treat mild to moderate erectile dysfunction. It's huge. No one talks about it because this is like not something you want to tell everybody, but I can tell you it's huge.
What about for prostatitis? Enlarged prostates or prostatitis.
You would use ozone for that.
Okay.
So there's rectal ozone, and there are practices that do like ozone injected into that, but obviously you have to do it with a protocol.
Yes.
Yeah.
I was just curious.
But yeah, so that's kind of like the range of different things that we can do with functional medicine and regenerative medicine. I freaking love the more I learn about what regenerative medicine can do, because there's also exosomes and stem cells. That's
and exosomes, isn't that like stem cells on crack or something like that? Yeah. See, just leave it. I'm Doc Harmony. I'm gonna break it down for you real simple, people. Real simple. So anyways.
Yes.
So we're coming up close to our actually we've been here almost chatting at 45 minutes because you're just amazing. So I do want to get back to is regenerative medicine including your parasite cleansing? And really what I would like to close with is, at the Queen Circle, we talk a lot about empowering women to reclaim their vitality, their sovereignty. And with this regenerative medicine or this parasite, what is that one big thing, piece of advice or something, suggestion? I know you can't give advice here, but suggestion how to offer women who feel disconnected from their bodies. I think so many women are just feeling like, oh my God, what am I in, right? And how can they really get ready to step into a new chapter of not just wellness, but back to self-leadership, right? Back to that vitality that you were talking about, that's so important. And I think that, yes, parasites is part of that, because if you got all them bugs in you, like, hello, you're feeding them, and then they die, and then they excrete, and oh my God, it's so toxic. If people really knew what was going on inside, oh my God, they would never eat processed food again, right? First of all. But how does this all kind of tie together? We've talked a lot about the hormones, and I think everybody has a really good basic of what they need to do and what to look for. And let's kind of close on that real positive note.
Well, what I want to leave everyone with is prioritize your sleep. Sleep. That if you don't do anything else, get yourself 7 to 8 hours of sleep. Now, obviously, most of you will have sleep issues and you can't sleep that much, or you either can't fall asleep because your mind is racing, or you sleep and you're waking up between like 4 o'clock in the morning and you're peeing, whatever it is that you're waking up for, that means your body is not detoxing. If you're not in deep sleep between 1 to 4, actually the best is really 11 to 4 a.m. Those hours are critical hours for your body to recover. So do what you need to do to get yourself some sleep. I also believe in practicing mindfulness and increasing your awareness. If anything you need to do, you gotta really take, the initiative to educate yourself. Self-education is very important. I spend the majority of my time educating my patients because knowledge is power. Knowledge is really power for us, and we can blame the system, you can blame the lack of healthcare that is right for us, but at the end of the day, we have the power. We have access to so much information now that there is no reason for us not to know about our body. So if you don't know about your body, watch all these YouTube videos, hear all the podcasts that you need to hear so that you understand your body more. And I believe in personal development. Like if you don't have the tools to get you unstuck, go talk to somebody. Doc Harmony, I know you support women and you have so many programs that you share and support women in. Talk to Doc Harmony about what courses you could do. But as far as healthcare, I do believe that you would get the best care if you work with a functional medicine doctor. I believe naturopathic medicine doctors are also very equivalent to that, a traditional Chinese medicine doctor, because I think it's not just one. You go see all of them and then learn about what resonate with you. Talk to people, talk to people with free discovery calls, just so you can understand what's out there, understand your options so that you can make informed choices. And I think we are living in a country that has more freedom and choices than any other country. We're not taking advantage of that. And so I believe that those are foundational things that you need to do, more so than any advice I can give you on this call. It's like you got to empower yourself with knowledge and surround yourself with people who want to help you.
No, and I think that's just so super great. We have AI, so there's just really no excuse.
The reason why I didn't mention AI,
yes,
if you used AI early on, it actually will tell you a lot of things and it brings in all modalities. If you use AI now, does not tell you the same thing. So I've been kind of tracking what AI respond to me with health problems. They will tell you all the things that we're talking about is misinformation. And that, so again, Googling is not going to work because Googling, if you're only going first pages, you're not going to find what you need.
Oh, hell, the first 3 to 5 pages. You have to go to page 10, 11, and 12 nowadays.
So know how the system works and beat the system is how I think about it. So don't be a victim to the systems that we live inside of.
Right, and that's a great point. So I have to tell my AI, I've trained it, I'm like, you're a naturopathic doctor, you're the greatest naturopathic doctor, and I'll reference, naturopathic doctors that are just fantastic and well-known. What would their protocol be, right? Or what would they think about it? So, and I agree with that. I do want to go back to the sleep issue because I constantly forget about this. As you know, I ended up with severe sleep apnea. Who knew? And that comes from menopause. When I went to the sleep doctor finally, because I was just exhausted, and he looks at I was greater than 30, greater than 30 is severe. I was at 56. There's a problem, and my oxygen levels were dropping down to 80. So so now I've got low oxygen in my brain. I'm completely exhausted. I was just to the point I was waking up just in tears every day, I've got to do this again. And so how do you, if I hadn't had these, heart attacks and was really looking at, I wasn't just first of all, I'm not on any meds, everybody, I'm not on any meds. And, trying, like True was saying, I'm like True because of people like True in my life. Why is this happening? Why would I have heart attacks? I'm a naturopath. I've been eating organic. I do meditation. I have a great life. I have well water. I live off the grid. You know what I mean? I don't even, I don't have plastics, every ticky mark is done, right? And so that sleep apnea really, my sleep doctor went, well, of course you had heart attacks. Like, what? Like, this is not an of course thing, so how can we, when would you know to go and get a sleep study? Because that could be a little pricey.
Yeah.
What are those symptoms? Because I agree with you, sleep is more important. Losing sleep is worse than smoking 2 packs of cigarettes a day, and they've proven this. 2 packs of cigarettes a day.
Yeah.
So what can we do? What would we look for?
If you wake up and you're tired, and that's the thing, people think that, oh yeah, I don't have it now or when you were younger, but as you get older, you will. And what blows my mind is you're skinny. You're not a typical person who would have sleep apnea. But that's the thing, right? We depend on these guidelines that, oh yeah, you don't match that. So then a doctor would never recommend her to go get a sleep apnea. But what you want to look for is that if you wake up and your mouth is dry, if you sleep with your mouth open and you snore, so you can ask your partner like, hey, I snore at night? Or do I stop breathing, like gasping for air? Or you wake up gasping for air, that's a clear sign. And then, but in general, if you wake up dry mouth, drowsy, not like rested, you should go do like a preliminary sleep study. But here's my take on it. They are expensive. Okay. And if you go into a center and do a sleep study, it's like, how the heck are you gonna sleep well in a place
all these cords
with a glass and all these lights shining on you? And I'm like, how is this study even like valid? It's not all valid. Yeah. So there are things now, I can't remember, but let me look it up really quick. It's like at home sleep study. They have companies now where it's FDA approved, and you put it on your wrist, called LOFTA, LOFTA is one company. Okay. And then there's the sleepdoctor.com.
Okay.
But look into companies that do at home study first, because then they will eliminate. And I believe the technology now around sleep is really advanced now. So do your research. Start with the ones I mentioned, and let's see if you can find something affordable at home first. But I believe everyone that wakes up tired should do some kind of testing. Now, a good way to prevent it is to use mouth tape. I use VIO2, VIO2. Just try it out. Like tape your mouth, give yourself 30 days. You got to commit to like a long time so you can really see a difference. My husband, he was like, I can't tell the difference. But after 2 weeks, he was like, oh, when he sleep without it, he was like, oh, I do sleep better with it. Right? So it's one of those things you have to give yourself, and track your symptoms, track your energy level. You don't depend on your memory to assess yourself. You gotta like actively track it, because our brain's not really that reliable to remember anything, to be honest.
I get it.
It. So yeah, I'm glad you brought up sleep apnea. It's a huge problem that are really undiagnosed, underdiagnosed, but also educated.
Yes.
Not being educated enough about sleep and sleep apnea.
Well, so everybody, I think that this has just been amazing. So we've covered a lot. We've covered hormones. We've covered the distinction between allopathic medicine and functional medicine and the difference, and how regenerative medicine can actually show up. And it's not about prevention, it's about rebuilding and restoring back. Like she said, we're in this toxic world and things happen, right? And so also we really want to remember, we didn't really get to dive into about parasites, but I really want to emphasize how important that this is. And this is, I can only imagine your clientele success went from a good rate to phenomenal, absolutely, because you're getting rid of these toxic little critters that are literally, eating up all your good stuff, right? sleep. I thank you so much for mentioning that, because that is so important. And self-education, right? Just really being your own best advocate. And that's hard to do sometimes, especially when you're not well. So everybody, I want you to go to, it's Conscious Medicine, right? What is your website?
Consciousmed.co. So
Conscious.
CONSCIOUSMED.co. And they can also call my assistant at 678-261-7879.
7879. And is this location in Alpharetta the one at Be So Well, or is there another location now?
So I actually see all my patients virtually. I do all of my regenerative medicine in Alpharetta. And we also have what you're referring to as Be So Well is our supplement store that we use to mainly service our patients, because I provide everything that my patient need so they don't have to. Because that was a challenge, because like sourcing all of these things that I've been using over the years have been very stressful and time consuming for patients. So I was able to kind of just get everything they need in that. But now it's just part of our regenerative medicine practice.
So anyone worldwide can see and visit Dr. True. And I do know I have a friend in Costa Rica who sees Dr. True, so I know that that's possible. And she does have her location in Alpharetta, Georgia, and it is consciousmed.co. And Dr. True, thank you so much for your wisdom. Thank you so much for your generosity, your time. I am just so delighted. And I just love working with you. Thank you so much for everything.
You're welcome, Dark Harmony. Thank you for having me. I love sharing about all of this. As you could see, I see myself get lit up when I have these conversations. So anytime. Thank you.
All right. I am Doc Harmony, and this is Dr. True, and healthy energy is an amazing life. Ciao.